Today we're going to talk about spore elevation of vitamin B12 with pernicious anemia. Now, within a 3 weeks period, 2 women, 40 and 46 years old, present with a peripheral neuropathy and associated pancytopenia with macrocytic anemia. Clinical suspicion for pernicious anemia was high, but vitamin B12 levels were 1644 per millimeters, 1228 per millimeters per liters, 1321 per millimeters, 975 per mole. Respectively, the reference range is 246 to 1320 per millimeters and 181 to 974 per millimeters per liter.
All right, guys, pernicious anemia is our next topic here. The way I like to remember pernicious anemia is that guy from Lord of the Rings, Gollum. You know, he's always going like this, precious, precious. So I like to remember that because there's so many types of anemias out there that it's like hard to keep track of which one's which. So if you guys remember precious in terms of pernicious anemia, you're going to remember that it's really almost, it's very close to your GI tract that Gollum rubs his hands. So that helps you remember that pernicious anemia starts with the GI tract. So pernicious anemia is all about your body not being able to absorb the tools needed to make red blood cells. That's my red blood cell right there. To make red blood cells inside the bone marrow. Now, if you know anything about how blood is made in your body, it's really actually quite simple. It's almost like going down to your hardware store and let's just say you're building a birdhouse. Well, for a birdhouse you need wood, you need nails, and you probably need a hammer to nail in those nails and then hang it on the tree, right? So all the birds can come.
In both patients, the blood counts responds to a treatment with vitamin B12, but both continue to have symptoms of peripheral neuropathy. There have been reports of false normal results of vitamin B12 levels generated by automated analyzers when the serum of patients with myeloblastic anemia is evaluated. The results have been attributed to the possibility that high levels of intrinsic factor blocking antibodies interfere with the AC112. Today, vitamin B12 assays are primarily performed on automated analyzers that apply a method based on the competitive binding of serum vitamin B12 with rearranged intrinsic factor.
This is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. This video is about pernicious anemia. Pernicious anemia is a decrease in the red blood cells that occurs when the body cannot properly absorb vitamin B12 to be exact. This happens from the gastrointestinal tract. Vitamin B12 is necessary for the proper development of red blood cells. Pernicious anemia is a type of megaloblastic anemia. That means the cells turn very large. The cause of pernicious anemia. The body needs vitamin B12 to make the red blood cells. To provide vitamin B12 to your blood cells, you need to eat enough foods containing vitamin B12, such as meat, poultry, shellfish, eggs, and dairy products. To absorb vitamin B12, your body uses a special protein called intrinsic factor, which is released by the cells in the stomach. The combination of vitamin B12 bound to this intrinsic factor is absorbed in the last part of the small intestine. When the stomach does not make enough intrinsic factor, the intestine cannot properly absorb vitamin.
Many of these platforms have also been found to be inaccurate when serum containing intrinsic factor blocking antibodies is analyzed. Disconcertingly, pernicious anemia is the most common cause of vitamin B12 deficiencies, and up to 70% of patients with pernicious anemia has been intrinsic factor blocking antibodies. To investigation further, we precipitate serum immunoglobulins by adding 25% of polyethylene glycol, by volume in 1:1 dilution with serum. Using unmodified and PEG treatment samples of serum from the 2 patients and from 3 control patients without microcytopenia anemia,
Pernicious anemia is a disease that causes the body to be denied of vitamin B12. Normally, the stomach has special cells called parietal cells. These special cells release a large molecule called intrinsic factor into the stomach. The important vitamin, vitamin B12, binds to this large molecule. This combination travels from the stomach to the intestine. There, the large molecule allows vitamin B12 to enter the blood. Now, let's look at what happens in pernicious anemia. In the stomach, a new large molecule called autoantibody appears that attacks and destroys the stomach's special cells. Without the special cells, the large molecule intrinsic factor is not released. Vitamin B12 now cannot bind to the large molecule. This means that when vitamin B12 travels to the intestine, it will not be able to enter the blood where the body can use it to help make red blood cells.
we then run the test for vitamin B12 levels in PEG treatment samples from the 2 patients with vitamin 12 levels decreased to below the limit of detection. The PEG treatment sample from the control showed a decrease of compatible with 1:1 dilutions. Thank you.